Welcome. In this guide, we're going to cut right through all the noise and give you the essential, expert-backed facts on breast augmentation. So whether this is something you're personally considering or you're just curious, our goal is to give you a really clear and unbiased look at the entire process. We're going to cover everything from the fundamental choices you'd have to make to what recovery really looks like day by day. So let's just dive right in and start with the basics.
First things first, what exactly are we talking about here? Let's get a crystal clear definition.
So breast augmentation is, at its heart, a surgical procedure to increase breast size. And there are two main ways to get there. One is by using implants, and the other is by transferring fat from another part of your own body. Because this is a pretty significant operation, it's always performed under general anesthesia, which means you're completely asleep for the whole thing.
Now this brings us to the first major decision you have to make in this whole process. When someone decides to go for this surgery, they have to choose between two very different methods. So let's put them side by side.
Okay, so implants. This is by far the most common approach. Basically, they're shells that are filled with either a silicone gel or a sterile saltwater solution called saline. They're designed to create a very specific size and shape. The other option is fat transfer, which is a totally different ballgame because it uses your body's own tissue. Fat is taken out using liposuction from an area like your stomach or thighs. It gets purified, and then it's strategically injected into the breasts. A lot of people who are looking for a more subtle and natural-feeling result tend to lean towards this option. So ultimately, the choice really comes down to using a medical device versus using your own tissue.
All right, so once that big decision is made, what does the surgery itself actually look like? Let's walk through the key steps together. Okay, so step one is the anesthesia we talked about. Then the surgeon makes a very precise incision, and they usually hide it in the crease under the breast to make any scarring as minimal as possible. From there, they create a little pocket to hold the implant. Now, a really critical decision happens here, the placement. The implant can go either behind the main chest muscle, or it can go directly behind the breast tissue, over the muscle. That choice is tailored to the person's body and what their aesthetic goals are. And finally, once everything is in place, the incisions are stitched closed and the surgery itself is done.
But you know, the surgery is only half the story. The recovery process that comes after is just as critical to the final outcome. So let's take a look at what that journey really entails.
Recovery really happens in stages. That first week is all about rest. You're going to see swelling and bruising, and that's completely normal. You can resume some light activities, but anything strenuous is absolutely off the table. Then over the next month or so, you can gradually get back to your routine, but any heavy lifting is still a no-go. By weeks 4 to 6, most normal activities are back on, with the big exception of targeted chest exercises. And as for the final results, well, you got to be patient. It usually takes about 3 to 6 months for all the swelling to go down for you to see how everything is settled.
The key takeaway here is pretty simple. Recovery is a marathon, not a sprint. Each phase is designed to let the body heal properly. If you rush back to your normal life too quickly, you could really compromise the results or even cause complications. That's why following your surgeon's instructions to the letter, it's not just a suggestion, you know? It's probably the most critical part of making sure you get a successful outcome.
And to really get the complete picture, we have to talk about the potential risks and the downsides. I mean, any surgery comes with them. And it's so important to be fully informed.
So, beyond the actual procedure and the recovery time, what are the other crucial things to consider? Let's take a closer look at the potential risks and some of the long-term implications.
Well, every surgery has general risks, right? Things like bleeding, infection, blood clots, or a reaction to the medication. But there are also risks that are specific to this procedure. You could have changes in sensation in the breast or nipple. Sometimes it's temporary, sometimes it's permanent. It can also sometimes impact the ability to breastfeed later on. Aesthetically, while surgeons are incredibly skilled at minimizing them, visible scars or a kind of rippling effect from the implant are possibilities. And finally, implants can rupture. If a salient implant ruptures, the salt water is just harmlessly absorbed by your body, but the empty implant shell still needs another surgery to be removed.
So after looking at all the facts, what's the bottom line? Well, it really comes down to this question. How do you balance your own aesthetic hopes with these medical realities? We've seen that breast augmentation is a complex medical procedure with two really distinct approaches, implants and fat transfer. We've walked through the surgery, the multi-stage recovery, and the significant risks involved. The ultimate decision really rests on carefully balancing those personal goals with all these medical facts. It's a journey that requires a ton of research, some deep reflection, and of course, realistic expectations. Thanks so much for joining us for this explainer.